Many sexual assault victims face a long and painful road to recovery. In a CBS News investigation out today, some of those victims are being stuck paying for the tests needed to prosecute their case.
The investigation found Wisconsin is one of more than a dozen states that sometimes sends victims a bill. News 8's Brittany Schmidt joins us now to explain.
Mike and Lisa, under Wisconsin law, the state is required to pay for the sexual assault exam. But there are other costs associated with the exam, such as ER fees or additional sexually transmitted disease testing. That is not always covered by the state. But when it comes to prosecution, the evidence in a rape kit can be key. And that's why local hospitals are making it a priority to help survivors handle any extra cost. La Crosse County District Attorney Tim Granke has been prosecuting sexual assault offenders for many years.
We want all the evidence we can get.
Every case is different, but when it comes to denial, a sexual assault kit can make the difference.
Certainly a lot of cases are tougher to prove without the kits.
A head-to-toe sexual assault exam is performed by a sexual assault nurse examiner.
They're going to do evidence collection, so they're going to collect for DNA. They're going to take pictures of any bruising, wounds, abrasions.
For sexual assault survivors, the process isn't easy, and the possibility of getting a bill for the exam is even harder.
It certainly could be re-traumatizing for an individual to continuously get a bill month after month about a rape that they had. That's the last thing we want someone to experience.
Under Wisconsin law, the state is required to pay for a sexual assault exam performed by a hospital.
There should be no charge for that.
After the exam, the hospital has two options for reimbursement, both through state funds. The first option is through the Victim Compensation Program.
The Crime Victim Compensation Fund requires that you're cooperating with law enforcement, meaning that you're going to make a report.
However, sometimes the survivor doesn't want to get the police involved. That's when the hospital opts for option number 2, the SAFE Fund.
If an individual comes in and they don't want to report it to police, we still don't want them to accrue a cost. So we'll apply to the SAFE Fund.
But either way, hospital officials say they will work with the survivor to handle any cost.
I certainly would not want someone's fear of their cost at an ER stopping them.
Especially if the sexual assault survivor decides to press charges.
The more evidence we have, certainly the stronger the case is. Without it, you can't go back and get that evidence later on.
A sexual assault exam can be performed up to 5 days after the assault happens. Mayo Clinic Health System holds on to the kits for a year so that if a survivor changes their mind and chooses to press charges, they still have the evidence to do so.
All right, thanks a lot, Brittany. Gunderson Health System follows a similar procedure.
A clinical manager with Gunderson's sexual assault program says patients may receive bills, but they are informed they will receive a bill until the outside agency pays. The sexual assault survivor is not expected to pay for the testing.